TELESTAR and TELECAST studies have evaluated a completely new drug, which is Telotristat. This is a specific inhibitor of the synthesis of serotonin, and serotonin is very commonly oversecreted in carcinoid tumors, in a proportion of carcinoid tumors. Like about in 20% of them, what we call functioning tumors. And this is causing a lot of symptoms to the patients that very negatively impact their quality of life, including diarrhea and flushing, and also is involved in carcinoid heart disease and mesenteric fibrosis, which can really impact negatively in the survival expectancy of patients, so prognosis. And so this is a very interesting drug that specifically inhibits tryptophan hydroxylase, which is the rate-limiting step for the serotonin synthesis. And by doing that, serotonin levels drop really very fast, and this has been shown to be to significantly control carcinoid syndrome diarrhea. So the two studies are a bit different in the kind of patients that they included. The TELESTAR included really very symptomatic carcinoid syndrome that was not controlled with standard doses of somatostatin analogs, which is the first step to control this syndrome. And the TELECAST included patients just with some either biochemical elevation of the serotonin metabolite or some symptom of carcinoid syndrome, but not so poorly controlled. So that's the main difference between the two studies. The two studies, it's a 12-week randomized double-blind study comparing no drug with 250 milligrams with 550 milligrams. And then after 12 weeks, all patients get open label 500 milligrams TID of Telotristat. And this study, what it has shown is that it decreases the number of bowel movements that patients have, and to me, probably the most striking thing and most relevant in the long term probably is that it really has shown a very important decrease in 5-HIA, which is the main in urine, which is the main metabolite of serotonin, and this is sustained in time. And this, I think, in the midterm can have other positive effects for patients in terms of lowering the development of carcinoid heart disease, which is an important thing, or mesenteric fibrosis. This hasn't been demonstrated, but I hope they really come up with more long-term follow-up studies that can deal with these other endpoints that are very relevant for patients too.